我哋先請政府嘅。
And it's time to make a start, so invite the administration in, please.
咁請
Members, please note the paper submitted by the administration regarding the questions that we raised. CB bracket 2 1582 stroke 1415 bracket 03.
好，咁我哋請食衞。
I'd like to invite Head eHealth Record Office, FHB, Mr. Sidney Chen, JP. If you're ready, please take us through the paper in response to the questions raised last time. Chairman, thank you. On the 26th of May and 27th of May, members raised certain questions, and the legal advisor also wrote us about the queries. I'd like to make a response here on the basis of the paper. We discussed Clause 58. There is a clause regarding the protection of public officers. Under Clause 48.3, if a public officer is appointed by the HRC to perform certain function in good faith, then there will not be any civil liability. But in the subclause 2, it clearly states that it doesn't affect the liability of the government for the act or omission. There was a question as to whether this is a common practice in the legislative provisions in Hong Kong. In paragraph 3, we explained that in the laws of Hong Kong, there are many examples in this category. There are 3 examples quoted: gas safety ordinance, personal data privacy ordinance, and competition ordinance. At the last meeting, members also asked, under 48.3, the commissioner can make appointment, and this person will also be conferred the protection. The legal advisor asked whether this will be a natural person or whether we're talking about a legal person. At the meeting last time, members asked about the criteria of selecting the contractor for whom the protection will be conferred, and what contractor will not have the protection conferred. Having considered members' views and the legal advisor's input, as we said last time, to implement the EHR system other than the government officials, we do need the assistance of the hospital authority staff to assist us in the maintenance and operation of the EHRSS. So under Clause 48.3, the Commissioner can specify the appointment of hospital staff, and the staff will enjoy the protection. We didn't have the contractors in mind for protection. Since members raised the question last time about the inclusion of the contractors and what criteria there will be, we'd like to move a CSA to the effect that under 48.3, the protection conferred upon the hospital authority staff and also the employee of the body corporate under the hospital authority, they will be conferred protection, and that would assuage the concerns about the contractors that will be given the protection and no liability will be attributed to them, and that would address the concerns raised by members as well as the legal advisor. Right, perhaps we pause here. Let's ponder this. In fact, this has been included in the CSA, the big bundle there. And this is included in the last point of the CSA. Members might wish to have a look and see whether there are any questions. Legal advisor, please. Chairman, thank you. I have received the administration's paper on Friday, and I do need a bit of time to digest the details. However, there are a couple of points here. Under CAP 113, the Hospital Authority Ordinance, regarding the protection of hospital staff, now under Section 5N, it provides that the hospital authority can set up a body corporate to conduct the work of the hospital authority and also to increase the quality of the service of the hospital authority. However, under Section 23, in terms of the protection of staff, the protection is not extended to the staff of a body corporate under the hospital authority. So the protection is rather narrow. It is a protection conferred upon the HA and the staff members. And this is consistent with the provisions that we normally see. In other words, the protection will be conferred upon the civil servants and also the members of the committees who will be serving the committee without any remuneration. But here, according to the proposal of the administration, the protection will be extended to the body corporates set up under 5N of the Hospital Authority Ordinance. What we're not clear is the nature of these body corporates.
So are they private or public entities? And we don't see the relationship between the HA and these institutes. Do they have a contractual relationship? If they do have contractual disputes or commercial disputes, will the HA have to bear civil liability, or do these institutes have to bear the liability? So regarding what I've said just now, all I can say is that I've observed that the legal policy, and there's a difference in legal policy between what we have here and what we have in the past. So could the government explain why is there such a difference? Mr. Chan, as I said just now, in the original wording in the bill, aside from covering civil servants, we also wanted to have coverage for the EHR commissioner and the people who work for the commissioner. At the time, members' concern was that if that is the case, the future commissioner, when they appoint a contractor or unknown person, so how, under what principles will these people be appointed? So as I explained, the amendment on this occasion is that people who are eligible, this has been narrowed. It is narrowed down to the point that according to 48.3, the commissioner will appoint HA staff or employees of a HA subsidiary, and that refers to the subsidiaries. And there are only two. One is the TCM under the HA, and the other one is EHR Hong Kong Limited. So we foresee that for the convenience of future operation and operation of the electronic health record, we might need some work subcontracted to these subsidiaries. So in order to be fair, since they are complying, they are working on behalf of us, complying with this law, so we would extend our provisions to these subsidiaries. So that is the intention of the policy. So could you elaborate? You said that EHR Hong Kong Limited, what do they do? Regarding TCM, they might be more understanding of that. They would provide TCM. Well, the TCM, they will provide future development of TCM, and there is some cooperation. And in the second phase, the TCM participation is very important. So we foresee in the future we will need these subsidiaries to provide TCM standardization of terminology and digitization. The other subsidiary is EHR Hong Kong Limited. The nature of this company is the same. They only have one mission. That is, they safeguard or keep software developed and assets developed out of the EHR policy. So they are a body that holds this information. This subsidiary was incorporated because of EHR. So we need to extend coverage to the staff of these subsidiaries. That is very reasonable. The future EHR commissioner will also have to state in writing that he is using 48.3 to cover which employee for the coverage to be effective. If we don't take that step, then they would not be covered. The comparison between the examples you quoted, this is more narrow. Why is it more narrow? The amendment is more narrow than the original bill drafting. The original drafting was just civil servants and the EHR commissioner, the people appointed by EHR commissioner under 48.3. So on the last occasion, members asked that that covers a lot of people. So since you have such a concern, so we've narrowed it down to just civil servants and HA staff or HA subsidiary staff. So that is what we mean by narrowing down. The legal advisor, do you have anything else to ask? Well, just now I had posed a series of questions, including the nature of the body corporates under the HA and its relationship with the HA, whether they have contracts with HA. So perhaps the government cannot answer immediately. They might need to go back and study that. So perhaps the Secretary could add this to the list of follow-up actions, and the government can respond in writing, because I think we have a policy issue here that needs further exploration, especially since there's a use of public funds. So when we scrutinize this bill, we need to consider if this legislation is adopted, when in the future when we scrutinize similar bills, will there be an impact? So allow me to have further discussions after their written submission, and when necessary I can report back to legislators. Mr. Chan, can you respond? Well, I think I explained our policy intention. We want to protect the subsidiaries of HA and HA. These staff, they will develop or operate the system. We are just protecting these people. We're not protecting all the other doctors, nurses, or those providing health care. So I don't think it is unclear. Well, I'm not sure if I interpret it correctly, but the HA ordinance seems to refer to HA staff and its committee members. That is very clear. But here we just have one additional item, that is under 5N of the HA we have body corporates and staff. You mentioned that there are just 2 subsidiaries currently, So the legal advisor just wishes to further confirm the contractual relationship, and if there is no big problem, legislators can consider this, and that it is uniform without dealing with the HA, and whether this coverage has been expanded. Well, the HA doesn't say that they, under their 5N, the staff under the body corporates are included, but here it's included. I don't think that is unreasonable. I just want to clarify this point. If ultimately the legal advisor has collected the information and written submission, and if there's no big problem, we can proceed. Otherwise, I will not want this to hinder our progress. So could legal advisor tell us what you have in mind? What information are you requesting? The function, the contractual relationship, and so on? Anything to add, Mr. Chan? Chairman, I suggest that since the legal advisor did not have sufficient time to digest the material, we can meet with the legal advisor after the meeting. We can provide more information about these two subsidiaries, its composition, and so on. I think our policy intention was explained thoroughly. These two subsidiaries are subsidiaries of HA. They do not have contractual relationship that the legal advisor was asking about. It doesn't matter. We can meet with the legal advisor. I do not want to provide another written submission, convene another meeting. Well, why don't you have a discussion first and see whether you can agree. If a document is submitted, we can just keep it. We can archive the material. We do not need to postpone our work progress because of this issue. Could we add this to a list of follow-up actions? Well, if we don't have questions on this, then we'll handle the draft CSAs proposed by Dr. Leung Ka Lau. The government also has some new suggestions. On the previous occasion, Dr. Leung Ka Lau had written a letter. He suggested a new design. In our previous written submission, we had explained why we do not agree with his reasoning. There are 3 reasons. We don't want to have any conflict or undermining of the two-way sharing. And second, he proposed a fundamental design change. And if that were adopted, then the government funding that was spent would be shelved, and we'd have to start from scratch again. And even if his CSA was adopted, our system would not be able to operate. So we had a discussion with Dr. Leung and other legislators. We understand Dr. Leung, under some special circumstances or special patient needs, he would wish that the health record only be made available to one institute, or only one institute would be able to make additions to the health record, and the consideration was to, in light of these 2 special conditions. We explained that in previous discussions regarding the safekeeping, the government has agreed that we'll have 16A, 16B, 2 provisions where they have sharing restrictions. This sharing restriction, after we have results from phase 2 studies, the future commissioner would announce these restrictions, and we could apply these restrictions proposed by the future commissioner. Now, since we have not stated the content of these restrictions, so we've allowed a very wide drafting that would satisfy Dr. Leung's special case considerations, that is, adding to the health record and only being able to read the record. Now, Dr. Leung was concerned about 16A, 16B, whether it could be interpreted so widely. Would 16A, 16B sharing restriction, would that be in conflict with Clause 16, Clause 12? So he raised this question on the last occasion. He wanted us to study the wording. So we followed up with DOJ colleagues, and we are aware of Dr. Leung's concern. We agree on this occasion that in 16A, 16B, we add some amendments. In the beginning, we state that despite anything contained in sections 12 and 16, we will add this new phrase. That is, despite anything contained in sections 12 and 16 at the beginning of clause 16A1. So this is the consensus that we reach with DOJ colleagues for legislators' approval. So that is in response to Dr. Leung's concern. We also have the final drafting in a separate document, so we'll see if legislators can accept this. So in 16A1, they will make an addition to express or to deal with Dr. Leung's concern in a more clear manner. Do we have any questions? Well, I don't have any questions. I think Dr. Leung would have a concern, but he is not here. Do you know what his stance is? So, is it the government intention that by adding this they wish to shut Dr. Leung up? Mr. Chan, do you wish to respond, or do you have anything to add?
I don't think you need to say anything on his behalf. My question is just whether you're aware of that. He's not here today. Yes, he said he's otherwise engaged. Yes, Mr. Chen, can you take the question? Chairman, I'm not sure whether this amendment would meet Dr. Leung's request. According to Dr. Leung last time, 16A and 16B may present some danger, the way it is written, because there may be conflicts with sections 12 and 16. And he said we have to clarify that there will be no conflicts whatsoever. So what we are proposing is in line with what Dr. Leung said. I think that would assuage some of his concerns. As to the other point about the fundamental change to the system, I'm not sure about that part. I don't think you would be able to meet the demand in that regard because you are unable to do so. Yes, we disagree with that part of the proposal. Right, it's up to us to decide today. I think Dr. Leung, if he's not happy with the amendment, he can certainly move his own amendment. Right, let me put this to members. Any questions? Chairman. Mr. Chen. Chairman, two-way sharing would be terribly important because the information would be available both to the private and the public sectors. If there are any changes whereby one side will not be able to have access to the other side's record, then this would not be consistent with the original intent. If the amendment would undermine the sharing of the information, and it would undermine the original intent. All right, any further comments? If not, we're going to look at the CSAs proposed by the administration later on as we go along. Now, we don't have to wait for Dr. Leung. Dr. Leung is unable to attend today's meeting. I think we have to decide whether we should, in the name of the committee, move the amendment on behalf of Dr. Leung. We'll be thin on the ground today, but I don't think members. Mr. Chen was shaking his head. Ms. Emily Lau first, perhaps. Chairman, there is a letter tabled in front of us, a letter by Dr. Lam, the CEO of Haven of Hope Christian Service, by Dr. Lam Ching Choi. There is a working group there, and he said this comes a bit late, and he knows that we're having a meeting today. He has some points to make. Chairman, how are we going to deal with this email? Yes, we can have a look at these under AOB. Now, these are questions about the key issues instead of the issues that we're dealing with. Perhaps we get the CSAs out of the way first before we come to this email. Mr. Chen. Chairman, Dr. Leung is not here today. If we move the CSA in the name of the Bills Committee, then I don't think I can subscribe to that, because this amendment will undermine the sharing intention, and this will not be consistent with the policy. So I doubt whether we should move this in the name of the committee. I don't think there is any strong view that we should take up the amendment. So we'll leave it to Dr. Leung. On Friday, up until Friday, he's still thinking about it. He might wish to move the CSA himself. All right, let's move on to the administration's paper. That's CB2 1583 1415 bracket 04. Mr. Chen, I think we have gone through all of them. I don't think we need to go through them one by one because we have already touched on them before. They're just put together. Perhaps you might wish to highlight some of the changes there. Chairman, thank you. Over the past 20 or so meetings, the administration has been discussing with the members the CSAs. In para 2, there is a table which sets out all the 22 amendments that we have agreed on. Some of them are of a minor nature, some of them are textual. Number 2 and number 3, for instance, they're textual or minor amendments. There are certain amendments that of a more substantial nature, and we do give them a clear explanation. As Chairman said, we have discussed them at previous meetings, some repeatedly, and basically we are putting in the same direction there. There are no major changes, with the exception perhaps the last 2, and we have included them in this table. The marked up versions are included in Annexes B, A and B. We have this marked up version for members to have better idea about the situation. We have checked it carefully, and we have missed out on anything at all. And if the Secretary has not spotted anything missing, this would be a pretty comprehensive list that covers all the amendments that we have come to an agreement on over the past 20-odd meetings. Legal advisor, please. Chairman, thank you. I noticed that in the table there is a new item which has not been covered before, and that is a textual amendment, item 12. Just for the record, item 12, clause 21(1). Right, item 12, clause 21(1), minor amendment. This is to amend the Chinese text. Madam Lee, please. Madam Lee. Chairman, if you look at the English version and the Chinese version, we'd like to align the meaning between the two versions. In English, there is a reference, a recipient may request at the registration, but in Chinese, this wording is not there, so we are proposing that like the phrase that underlined with double line, that is to request a registration. This is only a textual minor amendment. And not a withdrawal, but yes, it is about HCR can have a registration, and here one can request a deregistration. So that in the Chinese version, we made a reflecting the deregistration. Legal advisor, Chairman. 16A, 16B, and 30A. Earlier, the Privacy Commissioner confirmed that he's happy with that. And 16A and 35A will be amended again. Will the administration confirm with us that the Privacy Commissioner is also happy with the amendments? Mr. Chen. 16A, 16B, we have secured the confirmation of the Privacy Commissioner. In the light of Dr. Leung's concerns, we have added certain wordings, and we have asked the Privacy Commissioner, and he has given his agreement. Any more questions? No? All right, then, so we're done with the administration's CSAs, and we are done with the discussion on this. I think we should take this opportunity to have a look at the email that was referred to. And there's a letter by Dr. Lam Ching Choi. It was issued to us last night at 11-ish p.m. I haven't read it myself. I'm wondering whether the administration has got anything to respond. Ms. Lau asked whether there would be any response from the administration. Perhaps we might wish to have a look. How are we going to respond to the couple of points? The first one is limited accessibility of EHR among social service providers. So he's basically concerned about the social service providers. I don't think we need to go into detail blow by blow. Basically, he's concerned about whether the accessibility of the EHR will be good enough for the social service providers once it has been launched. Now, there are some general concerns and suggestions. Mr. Chen, you might wish to tell us the role of the social service providers and whether there are any means to help these social welfare organizations to help them avail themselves more of the system for the benefit of the users. Mr. Chen. Chairman, we've read Dr. Lam's letter. Heaven of Hope looks after a lot of the elderly people, and he's putting forward his views as a professional. Dr. Lam acknowledged that EHR is a good tool because if this is used appropriately, it would save time. It can save repeated tests, and there would be good reference for the doctors. And Dr. Lam feels that EHR is a good thing. In the first paragraph, he said that there are some social service providers that have subscribed to the EHR. He hopes that the welfare sector would embrace this system more extensively. Now, this is our intention. In fact, we'd like to expand the system to cover more service providers. The third and fourth paragraphs refer to the senior citizens, and they do need to have consistent level of services. So he's saying that EHR would be very helpful to the elderly services and the NGOs. If they have healthcare workers, should be able to take advantage of the EHR.
So he supports EHR, and he wishes to have more NGOs use this more conveniently, and it's very reasonable. I just want to follow up in his fourth point. He wants to promote equal access to HR amongst social welfare institutions, because these healthcare services are being widely promoted, and the electronic health records need to be equally accessed by the different institutes. So is the government aware, and is the government aware that social welfare institutes have difficulty in participating in these projects? Are there difficulties in the system, or do you need to do more promotion? Because he is advocating for equal access to EHR, so it seems that there are some obstacles. There isn't equal access. Is that the case? Well, Chairman, we are reading from the same letter. In his fourth point, well, in paragraph 1 and 2, he has given us the background context, and he says that he understands that the protection of privacy is important, but having a uniform social welfare healthcare platform will be affected if there's difficulty in accessing this material. So the patient health records, there should not be too many obstacles and restrictions in access. So all healthcare service providers should have equal access. There should not be a difference in access. So I think that is what he is referring to when he says there should be equal access to EHR among social services. So you're not saying that social services have more difficulty in accessing. Dr. Lam, are there any other restrictions that Dr. Lam perceives? Well, when the bill is endorsed, if a institute provides medical services and if they employ the 13 medical professionals, they can participate. These professional staff can have access to health records. So his wording, in his wording, he is of the view that NGOs will employ professionals to look after the elderly, and these professionals should have easier access to these records after the endorsement of the law. So our law is very clear that the institute has to provide medical services and they have to employ the 13 medical professionals. So if the NGO is eligible as a healthcare provider, then they can have access to elderly health records. Chairman, I'm aware of Dr. Lam's letter. Dr. Lam is speaking on behalf of Haven of Hope. They have elderly services. They have. I have personal experience with this. I have friends and relatives who have used the 3 types of services they provide. So I understand their need for access to EHR. Mr. Chan should be aware. His first statement in paragraph 4. Dr. Lam doesn't wish to have too many restrictions on data accessibility. So this ties in with our discussion about sharing of information, allowing the users, that is, participants receiving healthcare, they might have a privacy issue and certain information is not accessible. I have mentioned that in the past, and we should strike a balance. If there are too many restrictions, then the two-way sharing efficacy will be significantly undermined. But I'm also happy to see that the letter, Dr. Lam's letter, supports the two-way sharing of electronic health records. So if NGOs support this, I feel that our work is very meaningful then. And of course, we are now at the towards the end of our work. I'm not sure if we can complete it on this occasion. Coming back to Dr. Leongalau's concern, my view is that the government edition of 16A should address that concern. And I've also heard a further explanation, but I need to apologize that I'm commuting between this bill committee and the housing panel, so I'm hearing bits and pieces, but I seem to feel there is support. Well, I think Dr. Lam supports the EHR, and just now, Mr. Chan, you said you understand their position. So, when the bill is endorsed, when can they start to benefit from this change? Mr. Chan? We foresee that after the bill is endorsed, we would need 4 or 5 months preparation time. We need to print out application forms and do promotion work. and we can accept clinics, elderly centers, healthcare centers applications. On the last occasion, legislators made a similar suggestion. We need to promote heavily amongst the old age centers, healthcare centers. We're now in the middle of the year, so we hope the application can start, registration can start by the end of the year. So everything is commencing simultaneously. So hospitals, healthcare centers, everybody will benefit at the same time. Yes, we want to be in sync. We want to synchronize everything. All eligible parties can apply at the same time. So after hospitals have applied, when can they start sharing? So the first batch of private medical care providers, when can they start sharing? So you said they will only accept applications in 4 months' time. Technically, our sharing platform is already it's already in operation. It can operate. So when a clinic or healthcare institute applies, if the hospital medical system has connectivity, and after our audit, if we feel they are safe, they can start using the system to share the patient records. Now, different clinics and different private hospitals have different levels of computerization. Some hospitals might go faster. They might have more IT systems or more departments in place. So technically, when they register and their computer system is up and running, they can start sharing right away. Do we have private medical centers who have done testing or have done testing? Yes, there are. We had stated for the 9 types of information that can be shared, we had already designed different software modules. Let's say I want to upload or share lab results or medication history. So after developing these modules, we had tested it with private hospitals. In the last few months' trial, the situation is very ideal. So these institutes might be able to use our system earlier. Well, I'd like the government to provide a response, and we can respond to Dr. Lam in writing, and we can have a record when it will be in operation, when they can start applying, and they can start benefiting as soon as possible. Mr. Chan, can you do that? Yes, we can provide a response. We had considered contacting Dr. Lam. He has some ideas on how to improve the system. We will follow up. If we don't have any other questions, we have completed the whole bill and CSA scrutiny work. So let's ask the government, when will they consider a resumption of second reading? Mr. Chan, could you tell us what you have in mind? Of course, from the government perspective, we would like to resume second, third reading before the summer recess, and the sooner we can resume second, third reading, the sooner we can liaise with hospitals and patients. So after today's meeting, I think this is the last meeting, after this meeting, we will conclude the final drafting work, and before the end of this legislative year, we will resume second, third reading. Do you have dates in mind? They have not been able to set a date. We think the earliest would be 17th of June. 24th of June and 8th of July. Well, you can consider the dates. Well, we will wait for the government to decide on second reading date, whether this will affect our response to the House Committee. It will also affect members' amendments. Well, if they don't set a date, we can't report to the House Committee. Well, you want to go quicker, but you're holding us up now. We do have some responses, so let's wait for those responses, and we can see when we can submit the report to the House Committee. If it's not the 16th, then it will be the 19th. What's happening on the 12th of June? I don't have the date of 12th. Do we have a House Committee meeting on the 19th? The 24th of June. Then we need to report to the House Committee on 5th of June. If we resume second reading on 8th of July, we need to report to the House Committee on 19th of June. Well, if we don't have any AOB, well, then we do not need to arrange the next meeting. So I hope your written responses can resolve the questions we have and when we can submit to the House Committee. Thank you, everybody. Thank you for your support in the previous 22 meetings over the last year and a half, and hopefully we can endorse the bill within this legislative year, and the public can use this. Thank you, of government officials. Thank you for the Secretariat and government officials in the last 22 meetings.